Welcome back to the EAU podcast series Voices of Tomorrow's Urologists, journeying through Europe's resident perspectives. In this episode, we are joined by Stefano Puliatti, urologist and assistant professor in urology in Modena, Italy, and Enrico Checcucci, urologist in Turin, Italy. Together, they will explore new tech and standardization trends. Join us as we embark on this informative journey.
Good morning, everybody. I am Stefano Puliatti. I am assistant professor in urology at the University of Modena and a urologist in Modena. And today is a real pleasure for me as a member of the IAU Eurotech group to present this episode of this ESRU series. And this episode is about surgical training, unveiled, exploring new tech and standardization trends. And it is a real pleasure for me to introduce to you very, very good friend of mine. So I am really happy that we are together today. He doesn't deserve my presentation, but I think I have to introduce him for who doesn't know him already. Dr. Enrico Checcucci is a urologist in Turin at Candiolo Cancer Institute and is the past chairman of ESRU and a member of the IAU Eurotech group. Welcome, Enrico.
Thank you, Dr. Puliatti. Thank you, Stefano, for this kind invitation. I'm very happy to be here with you to speak about this important topic for the young urologist.
Great. So let's start to speak about training. We know that the training is a really key topic because it is really important and more important to train young surgeons. There are a lot of new technologies, there are a lot of new procedures to learn, and unfortunately there is a lot of bureaucracies to do that take out the trainees and the fellows from the training, the real training surgical sessions. So my question to you, Dr. Checcucci, is about a recent paper that we did together also with the IAU Eurotech team and with ESRU. You conducted, because you were really the mind of this paper, you conducted with the team a survey across Europe on urology surgical training, specifically focusing on the standardization of training programs and the availability of simulators. My question is, what is the rationale, what is the ratio behind the need for this survey?
Okay, thank you, Stefano. So the rationale of our survey arises from a recent report of Food and Drug Administration that reported more than 10,000 adverse events in robotic procedure between 2000 and 2013 in USA, considering the different specialties. Hence, there is a strong need for the creation of a well-organized, standardized, validated, and effective training plans in order to reduce the potential risk of intra- and post-operative adverse events. So, in this view, considering the available tools and the potential advantages provided by the integration of technology and three-dimensional simulation in the current surgical training, the dogma of the past of the see one, do one, and teach one is no more sustainable. So, following this direction and this consideration, in the past years, many centers and societies, such as the European School of Urology and the European Robotic Urology Section, have developed a standardized training pathway for specific procedures, aiming to reduce the current surgical learning curves for trainees and potentially prevent the perioperative risk for the patients. Therefore, the aim of our work was to provide a comprehensive overview of the current surgical training program across Europe, focusing in particular on the availability of simulation and a standardized surgical training program.
So I think that this paper was really well designed to understand a little bit what is the situation of training in Europe. Can you speak to us a little bit more about the main findings of your research?
Yes, we have a good success with the response rate of this survey that was spread across all Europe. We reached 375 responders covering 25 different countries. Of the responders, 50% had the possibility to use a dry lab, especially in laparoscopies, in 46% of the cases. So this is a very good results. On the other side, only the 16% of the participants had access to the wet lab. Focusing on new technology, the new technology-driven modalities of training are growing recently. In fact, the virtual lab was available in 31% of the center, especially for robotics and laparoscopy. Furthermore, after the evaluating of the surgical training pathway, 90% of the responders had the possibility to participate in any practical course. Also, the training modalities become to be a little bit more standardized, following a dedicated courses for the training. Among these 90% of the responders, the 32% benefit from an EAU or ESRU activities, and 41% participate in any official examinations such as the EBLOS or the EST. Non-technical skills were also evaluated and considered in almost 40% of the responders. So lastly, focusing on overall satisfaction of surgical training, the 50% revealed to be satisfied or very satisfied about their surgical training pathway.
This is a fantastic overview. Thanks for that. But we know also that now it is not only sufficient to be trained in open or only in lab surgery or only in robotic surgery. So a complete urologist now should be able to perform a little bit of everything and to know and to train in open, in lab, and in robotic surgery. So my question is, did you observe different trends based on the surgical approach, such as open or lap or robotics or endoscopic surgery?
Yes, the different peculiarities and diffusion of the different approach reflect also in the different training modalities, as you already mentioned. So focusing on open surgery, patient-based training resulted to be the most diffused in more than 80% of the cases. Regarding laparoscopy, while the primary training method remained directly on patients in 60% of the cases, we observed an increasing access to the animal model training. Also, the increasing approach was related to the virtual simulator and the 3D printed simulation in almost the 30% of the cases. The most common approach involved the performing surgical tasks step by step, followed by the standardized exercise. So a more rigorous and focused methodology also in the realization of the training courses. Focusing on robotics, virtual simulator emerged as the primary training model, followed by the directly on patients in 25% of the cases. However, the training was not evaluated in a significant percent of instances, more than 85%, with a final assessment notably being absent in 82% of the cases. Lastly, focusing on endourology, it is notable that the time allocated to training increased, with a 37% of responders dedicating over than 5 hours per week. And the predominant training models remained a hands-on patient experience, chosen in 68% of the responders.
Very interesting results. I don't know if you agree, but from my side, I think that is really important to take the training out from the real OR, take the training out from the real patient. And your data suggests that we should improve and implement training in this setting because we are not already there. We still train too much on the patient, and it can affect, obviously, the results of the surgery in the beginning part of the learning curve. So my last question is, what could be the next steps to improve the quality of surgical training during residency? And what are the limitations that we have now? What are the limitations that we can face in the next future? And what are the future perspectives, in your opinion?
Yes, I will try to respond to your last question, starting from the limitation and based on this lacking, trying to explore some potential future improvement. So even though we have seen a huge advancement in robotic and endourology training, there are still some key gaps that need attention and will guide the future evolution of surgical training. First of all, While simulators are super important on these new training programs, only a handful of them are actually proven to predict real-world performance. That limits how useful they are for learning. One exciting development could be the use, for example, as we already mentioned, of the 3D printing to make simulators more reliable and realistic. Another thing to keep in mind is that progression-based methodology seems to work better than the traditional methods. Most of the evidence for this comes from preclinical studies. So robotics has driven this shift in how we train, but endourology is a little bit behind. And even though robotic surgeries are becoming more common, there's still no standardized methodology based on the PBP, basic training pathway, in their place. So not are they dedicated metrics to measure the success. We can also say that then there is the limitation of the cost. The simulation-based training is expensive and keeping everything up to date and adds another layer of difficulties. The good news is that the study showed that the skill learning on the simulator transfer well to the real surgery. But with the new robotic system hitting the market, we'll need new programs to ensure that the beginners get the best possible training. What we really need is a unified training program across the urology, backed by randomized studies to help us better understand the real cost and benefits of the progression-based methodologies and how these affect patient outcomes. Programs like the ORSI consensus meeting, the CISA, and the entry program of EAU are already trying to lay the groundwork for this future training. So looking ahead, it makes sense to propose a comprehensive progression-based methodology training pathway that could be applied to both robotic and urological procedure, and even adapted for other areas in urology. The goal could be standardize the training outcome and eventually to set up a certification system for surgical skills, including procedure-specific metrics, and train the trainer courses would help to guarantee the quality and consistency of the training. Obviously, I mentioned the new technology, such as the artificial intelligence and machine learning, that can potentially help us to improve how to assist the training performance, eliminating the bias of human judgment and cutting down the time it takes to evaluate the skills.
Thanks, Dr. Checcucci, for this overview of what we need and what are the future needs in the field of training. I think that you cited a lot of very important and key points as having a methodology that can assess the proficiency of the trainee before going in the OR. It is obviously key, but it should be efficient and effective for the results that the methodology can realize, and on the other side, efficient because the money and the costs are really important, and the investment should be really focused on improving the results at the end on the patient and the possibility to have really an effective training. I fully agree with you. We have data. You cited the OCERT meeting in which we showed that the proficiency-based progression training is really effective but also efficient, because if it is applied in the good way, in the good manner, then it is possible to avoid to waste money and to make everything really efficient. So thanks a lot for this great overview, Enrico. Was really a fantastic window on the future of training, and I think it will be important to follow up your points and to speak about that in Europe, to speak about that with the scientific societies, with the universities, and with the companies. If you have close remarks.
I would like just to thank you, Stefano, to be here with for this invitation, and it's a pleasure for me to be here. And I would like to thank the EAU, and it's a good honor and it's a good opportunity also for ESRU to have the possibility to present, to participate in this podcast series. So thank you, and I hope that this short podcast can help the listeners to have an overview of the actual and the future perspective of surgical training.
Thanks, Enrico, and see you next time.
Thank you.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.